Hello, good evening. I am Dr. Sujoy Dasgupta, consultant gynecologist and infertility and IVF specialist. Today, we are going to discuss about PCOS, especially about PCOS and infertility, because probably you know that September is celebrated as PCOS Awareness Month. Now, what is PCOS? Probably all of you are aware of this term PCOS, polycystic ovary syndrome. It's a chronic disorder. There are different features of polycystic ovary syndrome. Number one is that in ultrasound, there will be polycystic ovaries. That is, ovaries would look like polycystic. What does that mean? In normal ovary, there are a number of follicles. Follicle means fluid-filled structures inside which there are eggs. In polycystic ovary, the number of follicles are greater than normal. This is called polycystic ovary. Number two, there may be, because of polycystic ovary, there may be difficulty in ovulation. That is, eggs are not growing or eggs may be growing but they are not released, because to have pregnancy or to have regular periods, you should have ovulation. That is, your egg should grow and the egg should be released by the middle of the cycle. If eggs are not released, this is called anovulation, and it can cause irregular menstrual cycle. That is, your periods may be irregular, or it can cause difficulty in conceiving. That is infertility. And number three, there are some hormonal imbalance in PCOS. There are two hormones secreted and two hormones which are altered. Number one is insulin and number two is testosterone. We know insulin is a hormone secreted from the pancreas that controls our blood sugar level. In PCOS, the insulin is there, but insulin cannot act because of some problem which we call it insulin resistance. That is, insulin cannot act in the cells. As a result, the blood sugar may rise, and because of insulin resistance, because of increased insulin in the body, it can cause weight gain. It can cause other problems like high blood pressure, hypertension, diabetes. It can cause cardiovascular disease like heart attack, stroke. It can affect your liver. Cirrhosis of liver can happen. It can cause fat deposition in your neck, and it can cause obstructive sleep apnea, that is snoring at night and drowsiness in the daytime, and it increases the risk of heart attack. And sometimes, particularly if periods are too irregular, that is, if periods are happening once in every 3 to 4 months, that is less than 3 periods in a year, it can cause thickening of the lining of the womb, we call endometrium, that is thickening of the endometrium. And sometimes this thickening of the endometrium can cause endometrial cancer. Therefore, insulin resistance is a problem. And another hormone is altered, that is testosterone. We know testosterone is a sex hormone that is present in men, but in women also there are testosterone, and PCOS, what happens, the testosterone level is high, and because of increased testosterone level, you may have period irregularities, you may have excess hair growth, that is problems of excess testosterone, you may have excess hair growth in the face, that is called hirsutism, excess hair growth in other parts of the body, you can have hair loss in the scalp, you can have excess oily skin, acne, pimples, etc. And there is some condition called acanthosis, that is, you can have black patch in the back of your neck or in your armpit. Now, please remember, if your ultrasound report is suggesting that polycystic ovary, that does not always mean that you are having PCOS. To have PCOS, you must have at least two of these three features. What are these three features? Number one, ultrasound will be showing the polycystic ovary. Number two, your periods will be irregular. And number three, you should have features of excess testosterone level. Either your blood test will show excess testosterone, or you have features of excess testosterone like excess hair growth or oily skin, etc. If you have at least two of these three features, then you are said to have PCOS. But if you are having only polycystic ovary, remember, if we are doing ultrasound of 100 women in the reproductive age group, that is women from 15 to 45 years of age, out of 100 women, in 70 women we will find ultrasound will show polycystic ovary. But that does not mean that you are having PCOS. To have PCOS along with polycystic ovary, you must have other features. And please remember, PCOS is not the disease of the cysts. Sometimes women are coming to our clinic and saying that, doctors, I am having cysts, that's why I am having irregular periods. Remember, we have another Facebook Live on ovarian cyst. We have done it last month. So if you have any queries regarding ovarian cyst, please have a look in that video. We are not going to discuss about the details of the cyst today. But we are going to discuss about polycystic ovary. Polycystic ovary is not a disease of the cyst, because cysts can be treated surgically and can be cured. But unfortunately, polycystic ovary syndrome, PCOS, cannot be cured. But remember, PCOS can be kept under control. How? By simple lifestyle changes, that is weight control. And to control your weight, two things are equally important. Number one is diet, and number two is exercise. You have to do both the things. You should not have sedentary lifestyle. That is, you should not spend your time by sitting for a prolonged period of time. If possible, go to gym. If that's not possible, do skipping at home and walk for at least half an hour every day. And avoid escalators or elevators or lift, and use stairs as much as possible. And for diet, it's better to consult expert dietitian. In layman's language, I will ask you to avoid high calorie diets. That is like food like very oily food, food containing very high content of sweet, and have excess. Try to take an extra amount of vegetables and fruits, and it's better to contact a dietitian to have proper diet chart. Now, PCOS cannot be cured, but it can be kept under control. So how we treat PCOS? It all depends on what you want. If your problem is only irregular periods, if you are not interested in pregnancy right now, of course, in that case, lifestyle changes are important. We will advise diet and exercise. But in this case, we can give you oral contraceptive pill. Remember, contraceptive pills are safe. Contraceptive pills do not increase the risk of cancer. Rather, contraceptive pills can reduce the risk of ovarian and endometrial cancer. And in polycystic ovary syndrome, if you are taking contraceptive pills, your periods will be regular. Your hormonal imbalance will be regularized, and you should not worry about pregnancy. Even if you are unmarried, if you can tell a doctor, I don't want contraception, I am single, I don't want contraception. But in that case also, contraceptive pills can work well, and contraceptive pill we can give even the adolescent girls. So please move away from the lots of myths and misconception about contraceptive pills. And contraceptive pills can prevent pregnancy so long you are continuing it. Whenever you are planning for pregnancy, you can simply stop contraceptive pill. It will not cause infertility in the long term. That is, it will not cause difficulty in conceiving after you stop the contraceptive pill. Therefore, you can jolly well take the contraceptive pill. Number two is that you are not planning for pregnancy. Your periods are regular or sometimes maybe irregular, but you are much more concerned about excess hair growth or oily skin or hair loss. In that case, what we can do? We have to look for other possible cause of excess hair growth. We may need to do other hormonal tests as well. At the same time, we can get some special type of contraceptive pills. But remember, in this case, whether these contraceptive pills are working on your health, working on your hair growth or not, to see this effect, you have to wait for 6 months. Why 6 months? Because our hair growth cycle consists of 6 months. You have to wait for 6 months before you can expect any good result. If after 6 months you cannot see any good effect, then we can change the pill or we can add additional medicines. Meanwhile, you can do some local treatments. You can consult dermatologists. You can consult skin specialists, and you can do some special treatments like laser, shaving, specialized cream. These things you can take. But remember, one thing I forgot to mention. As PCOS is a chronic disorder like diabetes, hypertension, these are chronic disorders. Similarly, PCOS is a chronic disorder as it cannot be cured. You should have regular visit to the doctor and lifestyle changes should be done throughout the life. That is, you should check your blood pressure, lipid profile, and blood sugar level at least once in a year, and you should visit the doctor regularly. Now, third condition, you are having PCOS and you are planning for pregnancy. What you can do? Of course, the number one thing that I mentioned, you have to do the lifestyle changes, that is diet and exercise. There is no alternative of diet, lifestyle changes. Many women may not require any additional treatment. They can simply conceive after doing the lifestyle changes. For example, your weight is 90 kg. Your ideal weight should be 50 kg, but it's not possible to lose 40 kg overnight. Your target should be to lose at least 0.5 to 1 kg overnight. 0.5 to 1 kg per week. If you can lose at least 5 to 10% of your weight, that can have positive impact. That can sometimes regularize your periods and that can lead to pregnancy. If that does not work, then we have to find out other possible causes. We have to look for the semen analysis. We have to look whether your husband or partner's sperms are okay or not. And sometimes we may need to look for your condition of your tubes. But when we look for tubes and sperms, when you have spent at least 6 months for pregnancy, that is, if you fail to conceive after 6 months, then we'll see whether your husband's sperms are okay or not. And sometimes we need to see whether your tubes are okay or not. Then we'll start medicines. Sometimes we may need to give you some medicines like metformin or inositol, but there are again lots of myths and misconceptions about metformin. Whenever we give metformin, people are saying, doctor, it's a medicine for blood sugar control. I don't have diabetes, so why should I take metformin? And sometimes even the medicine shop people, the shop owners of medicine shops, they are saying that, oh my God, the doctor has advised you metformin. That means you are having blood sugar. Remember, metformin can be taken in PCOS even when your blood sugar is normal, because it will not lower down your blood sugar when it is normal. It will lower down your blood sugar when it is abnormally high. But if your blood sugar is normal, it will not cause low blood sugar. So rest assured, metformin can be taken safely and metformin is safe for pregnancy. Of course, metformin can have some side effects like gastric problems, like bloating, some indigestion. Sometimes it can happen, but metformin is safe. Now, these women who are planning for pregnancy and they are having PCOS and irregular periods, they are asking, doctor, what we can do to regularize our periods. In that case, sometimes women are asking, doctor, I am having PCOS. First, please regularize my periods and then I will plan for pregnancy. We say, see, this is not possible. Because to regularize your periods, we have to give you either oral contraceptive pill or progesterone on regular basis. And it will prevent pregnancy. Therefore, we cannot regularize your periods if you are having PCOS and if you are planning for pregnancy. But certainly, we can give you pregnancy. How? We advise to do urine pregnancy test once you miss your period. And remember, the test can be done on the very next day if you miss your period. Suppose your last period was on 28 August. Currently your period date is 28 September. If you are not having periods till 29 September, you can do pregnancy test and it should turn positive if you are pregnant. If it is negative, then you can take medicines like medroxyprogesterone acetate, which we advise in our clinic. You have to take the medicine for 5 days, but remember, you have to be patient after taking the medicines, because sometimes women think that after taking the medicines, the period should start immediately on the next day. It's not correct, because sometimes period can start within 10 to 14 days after stopping the tablet. Therefore, you should have patience. You should wait till 10 to 14 days after stopping the periods. Therefore, we may not be able to regularize your periods, but you can have regular periods if you take the medicine, and this medicine is safe. Even if you are taking the pills when you are not sure if you are pregnant or not, it will not harm the baby. It will not cause any abnormality. Now, Mrs. Pinky Bhattacharya wants to join in our Facebook Live. So we want to welcome her. Hello, how are you?
Thank you, sir. I'm good, sir. How are you, sir?
Yeah, fine, thank you. Yeah, so do you have any query?
স্যার আপনার কাছে স্যার আমি 2 মাস আগে একটু লাইভ সাত ভিজিট করেছিল স্যার আপনার একটা ভিডিও কলিং এ স্যার আপনি আমার তো পিসিওডি আছে স্যার আমি স্যার আপনি যেটা আমাকে কন্ট্রাসেপ্টিভ পিল দিয়েছে স্যার ওটা আমি খাচ্ছে তো এমনি তো পিরিয়ডসটা স্যার রেগুলারে হচ্ছে
না, আপনি যখন আপনি প্রেগন্যান্সি প্ল্যান করছেন না, তাহলে আপনি কন্ট্রাসেপ্টিভ পিল কন্টিনিউ করতে পারেন। আপনার এই কন্ট্রাসেপ্টিভ কন্টিনিউ করলে কোনো
স্যার
অসুবিধা নেই।
প্রেগন্যান্সি প্ল্যানিং করলে স্যার আপনার কাছে ভিজিট করব স্যার আগে একটু যাব।
হ্যাঁ, তাহলে যতদিন আপনি প্রেগন্যান্সি প্ল্যান করছেন আপনি ইজিলি কন্ট্রাসেপ্টিভ পিল নিতে পারেন। হ্যাঁ,
ঠিক আছে স্যার ঠিক আছে।
আপনি আর কিছু বলতে চান? আপনার পিসিওএস বা আপনার যে প্রেগন্যান্সি আসতে সমস্যা, সেই কিছু যা আগের সমস্যা কিছু নিয়ে আপনি কিছু আপনার অভিজ্ঞতা শেয়ার করতে চান, বা আপনি অন্য পেশেন্টদের কিছু বলতে চান পিসিওএস নিয়ে?
হ্যাঁ আমার স্যার আমার তো 2000 মানে 10 বছর আগে দিকে পিসিওডি আছে। যখন স্যার অনেক ডক্টরের কাছে আমি গেছিলাম, যে ডক্টরের কাছে অনেক ডক্টর বলে কি তোমার ন্যাচারাল দিকে কিছু হবে না, যদি আইভিএফ আইইউ করো তখনও 50-50 চান্স হবে স্যার কলকাতায়। তারপরে স্যার আপনার কাছে গেলাম স্যার, আপনি আমাকে 6 মান্থে মেডিসিন দিয়েছিলেন। একটু আমার মনে আছে একটু সুগারের মেডিসিন স্যার, একটু গ্রিন কালার মধ্যে আর একটু এক্সারসাইজ করতে বললো, লাইফস্টাইলটা একটু চেঞ্জ করতে বললো স্যার। তখন স্যার 6 মাসের ভিতরে স্যার আপনার মেডিসিন, যেটা আপনার অ্যাডভাইস আপনি আমাকে দিয়েছিলেন ওইটা আমি একটা একটা করি স্যার, আমি একটা স্টেপ স্যার ওটা ওরকম করছিলাম স্যার। ওর মধ্যে স্যার আমার প্রেগনেন্সিটা ন্যাচারালি কনসিভ হয়েছিল স্যার।
ধন্যবাদ, ধন্যবাদ।
স্যার মেয়ে আমার এখন 3 বছর সুস্থ আছে স্যার। থ্যাংক ইউ সো মাচ স্যার। স্যার আপনার জন্য এটা সম্ভব হচ্ছে স্যার, না হলে আমি তো মানে হারিয়ে গেছিলাম যে কি হবে। অনেক ধন্যবাদ স্যার, অনেক ধন্যবাদ স্যার।
তাহলে আমরা রাখছি এখন, আমরা আবার ফেসবুক লাইভটা কন্টিনিউ করি এখন।
ওকে স্যার, থ্যাংক ইউ স্যার। ওকে স্যার।
ওকে। Okay, so now we are back to our discussion on polycystic ovary and infertility. So first thing is that you have to control your weight. Next thing is that sometimes we may need to give you some medicines like inositol or metformin. Thirdly, you can have regular periods if you are taking progesterone once you miss your periods. Okay. Fourthly, if this do not happen, then we have to go for ovulation induction, because as I have said, the main problem in PCOS, why women with PCOS can't conceive, is problem in ovulation. So therefore, we have to give the medicine so that you should have ovulation. Initially, we try oral medicines like letrozole or clomiphene citrate. Remember, if you are taking the medicines, you should not just take the medicines at home. You have to visit the doctor and do follicular study by TVS. Remember, follicular study should not be done by abdominal ultrasound. It should be done by TVS, transvaginal ultrasound. That is, in our clinic, we insert the ultrasound probe in the vagina and see whether this medicine is working for you. Unfortunately, we sometimes see that women are taking these medicines months after months, 6 months, 12 months, 24 months without doing TVS. We'll say this is the waste of time. Why? Because if you don't know whether this medicine is working for you, if the medicine is causing ovulation or not, then taking the medicines month after month is a waste of time. Maybe this medicine is not causing ovulation, that's why you are having problems in getting pregnant. Therefore, whenever you are taking the medicine for ovulation induction like letrozole or clomiphene, please do follicular study, and should be done by TVS, not by abdominal ultrasound. There may be two conditions. Number one is this medicine is causing ovulation. In that case, remember, even if you are having ovulation and you are having regular intercourse, that is 2 to 3 times in a week. That does not mean that you should have intercourse only between day 10 to 14. This is obsolete idea. You should have regular intercourse at least 2 to 3 times in a week. In that case, the chance of pregnancy per month is 10%. That is, out of 100 women who had ovulation and who had regular relationship with their partners, out of 100, 10 can conceive within 1 month. Therefore, if you can't conceive in 1 month, don't lose hope. You can continue the tablet for next 3 to 4 months, but not more than 6 months. If you are taking the tablet for more than 6 months, it's again the waste of time. Therefore, if this tablet is tablet caused ovulation, but you fail to pregnant after 3 to 4 months, depending on the age, because if your age is on the higher side, you cannot wait for 3 to 4 months. Then we can give the medicine for maximum for 2 months. If that doesn't work, we have to move forward. The next step is we can do ovulation induction with gonadotropin injection. That is, you still can have the possibility of conceiving naturally. But remember, if we are giving gonadotropin injection, it's mandatory to have follicular study, because sometimes the gonadotropin injections can have some side effects. Like, it can sometimes cause multiple pregnancy. You can have twin or triplets, sometimes, not always. And sometimes you can have excess response, that is called ovarian hyperstimulation syndrome. Most of the time, that is what happens for ovarian hyperstimulation syndrome. You can have excess follicles in the ovaries, and it can cause temporary problems like swelling of your tummy, bloating, digestion problems, etc. But it will resolve once your periods are happening. In rare cases, like in 1% cases, it can cause severe VHSs, and you may require hospital admission, because it can cause fluid accumulation in your body, in tummy, in your chest, etc. But don't get scared. It's very rare, and we can prevent it by giving the lowest dose of gonadotropin injection. If now, for how long you can take gonadotropin injection? Maximum 3 to 4 months. If that does not work, then you have to consider IUI, intrauterine insemination. Sorry, I forgot to mention the chance of conception with gonadotropin injection is around 10 to 15% per cycle. That is, out of 100 women who are taking gonadotropin injection and who are having ovulation, as seen in previous follicular study, and who are having regular relationship with their partner, the chance of pregnancy first cycle is 10 to 15%. Out of 100, 10 to 15 can conceive. If you still can't conceive, unfortunately, in 3 to 4 months, you can consider doing IUI, provided that your tubes are okay and your husband's sperms are okay. IUI means we have to do the same thing like ovulation induction. We have to give gonadotropin injection. We have to do TPS follicular study. And during IUI, we advise the couples to have regular intercourse at the same time. That is, you should try naturally in the same cycle, because it increases the success rate of IUI. Overall, the success rate of IUI is 15 to 20% per cycle. That is, if 100 women are doing IUI, 15 to 20 can conceive in 1 month. IUI means we'll collect husband's sperms and process it, and we put inside the with a catheter inside the wife's uterus. IUI can be done for maximum 3 to 4 cycles depending on the age. If that does not work, in that case, you should go for IVF. We have other videos of IVF, so we are not going into details of IVF. In IVF, of course, there is little chance of developing ovarian hyperstimulation syndrome, so we have to be very cautious about it. But we usually, in what happens in PCOS women, we don't do fresh embryo transfer. We freeze all the embryos, so that even if you have ovarian hyperstimulation, it should resolve. And we do the embryo transfer after 3 to 4 months, usually. And remember, the chance of success with IVF is 40 to 50%. That is, out of 100 women doing IVF, 40 to 50 can conceive in one go. That is in the first cycle. And in PCOS women, particularly those who are young, the chance of pregnancy is very high with different treatments. But remember, majority of the women with PCOS, they don't require IUI or IVF. They can conceive naturally even without medicines, or they can conceive naturally after doing simple treatment like ovulation induction with tablets. Few require gonadotropin injection. Very few require IUI or IVF. But of course, if you have tube block, you should do IVF. If your husband's sperms are not okay, then depending on the severity of sperm problems, you may require IUI or IVF.
Now, what happens if the oral tablets given to you is not working, that is, it's not causing ovulation? Suppose you have taken the oral tablets like letrozole or clomiphene, and it's not causing ovulation. In that case, there is no use of taking the same tablets after 3-4 months. If this is working, then you should take the tablet for 3-4 months. If it is not working, then there is no use of taking the same tablet for 3 to 4 months because it's useless and it's a waste of money and valuable time. In that case, if you have taken letrozole, we can shift to clomiphene, or if you have taken clomiphene, we can shift to letrozole. If that, even if it's still that doesn't work, then we have to go for ovulation induction with gonadotropin injections. Now, sometimes women are asking, doctor, I'm having PCOS, polycystic ovary syndrome. Should I do laparoscopic ovarian drilling? Remember, laparoscopic ovarian drilling was very much popular like 10-20 years ago for polycystic ovary syndrome. Nowadays, we are using it we are advising it very rarely. When you should do laparoscopic ovarian drilling? First of all, what is laparoscopic ovarian? Laparoscopy, you know, it's a microsurgery, is a keyhole surgery where we insert a scope, a telescope inside your tummy, and see inside your tummy different areas of your tummies like tubes, ovaries, uterus. This is the advantage of doing microsurgery. And by the help of specialized electric current, we can burn some of the follicles, excess follicles that are present in polycystic ovary. And this burning can increase the chance of your ovulation, it can regularize your periods, and it can cause spontaneous conception. But remember, laparoscopic ovarian drilling, if it's not done in proper way, it can do more harm than good. If it is done in excessive manner, you can land up in tube lock because of adhesion, because of abnormal attachment between different organs. And one dangerous complication of laparoscopic ovarian drilling is that it can sometimes cause premature menopause if it is not done properly. That is, your ovaries may be so much damaged that it will not produce any hormone at all, and your periods will stop permanently. That is menopause, which should happen by 45 to 50 years. It can happen as early as 25 to 30. Therefore, you should be very much cautious before doing laparoscopic ovarian drilling. Therefore, if your doctor has advised you laparoscopic ovarian drilling, you should see whether it's actually required for you or not. When it is required, if your weight is normal, then if your weight is excessive, then laparoscopic ovarian drilling will not work. Number two, if oral tablets are not causing ovulation, that is, if you have taken clomiphene or letrozole, still you fail to ovulate, then number three, if there is any other indication of doing laparoscopy, like tube block, like you have endometriosis, like you have fibroid, if you have severe pain during periods. But remember, before doing laparoscopic ovarian drilling, please do these two blood tests, AMH and LH. If your AMH is too high, then you should do laparoscopic ovarian drilling. Otherwise, laparoscopic ovarian drilling will cause more harm. Number two, check the luteinizing hormone level in your blood on day 2 or day 3 of your periods. If LH level is more than 10 international unit per ml, in that case, laparoscopic ovarian drilling will help. If your LH level is less than 10, then please don't do laparoscopic ovarian drilling. And mostly people want to do laparoscopic ovarian drilling if they don't want to try gonadotropin for ovulation induction, or if they don't want to go for IUI or IVF. Therefore, the use of laparoscopic ovarian drilling has declined, because sometimes you have seen the women who had regular periods, who had good number of follicles because of polycystic ovary, but they have done laparoscopic ovarian drilling in incorrect manner and they have landed up in premature menopause. Therefore, you should be cautious. Now, even if you get pregnant in polycystic ovary, the story doesn't end here, because polycystic ovary syndrome is a risk factor for early miscarriage, particularly if your weight is on the higher side. Therefore, you have to visit the doctor regularly. Next is that in pregnancy, you are at risk of preeclampsia, that is high blood pressure and leakage of protein in urine. That can affect different organ systems in your body. Therefore, you should check your blood pressure regularly. and check your urine regularly, and you should visit the doctor. And number 3 is that you are at risk of developing gestational diabetes mellitus, GDM. What happens if you develop GDM in pregnancy? Gestational diabetes mellitus can cause abnormalities in the baby. It can increase the risk of miscarriage. It can cause sudden death of the baby, particularly if the blood sugar is not well controlled. If blood sugar is well controlled, you should not feel scared. It can cause abnormal growth of the baby. It can cause premature delivery. After delivery, your baby is at risk of low blood sugar, breathing troubles, feeding troubles, NICU admission, etc. In pregnancy, you are at risk of developing high blood pressure, infection, and bleeding. And after delivery, even after delivery, you are at risk of developing permanent diabetes mellitus. How we can check for gestational diabetes in pregnancy? For all women, irrespective of whether you had PCOS or not, we do oral glucose tolerance test as per international recommendation. Therefore, in pregnancy, please don't do random blood sugar or simple PP blood sugar to see whether you are having gestational diabetes mellitus or not. Because if you miss gestational diabetes mellitus diagnosis, you can land up in serious problems. When you should do OGTT? At 12 weeks of pregnancy and around 28 weeks of pregnancy. How? You should check the blood sugar after 2 hours after taking 75 grams of glucose. Normal PP sugar will not help. Therefore, please do OGTT after taking 75 grams of blood sugar at 12 weeks and 28 weeks. Therefore, in a nutshell, polycystic ovary is a condition where you can have difficulty in conceiving, you can have irregular periods, but in most cases, it can be kept under control by lifestyle changes, and most of the women can conceive naturally. Very few are with ovulation induction, but if you are doing ovulation induction, it's mandatory to have TPS follicular study to see if you are ovulating or not. And don't take ovulation induction with the same medicines for more than 3 to 4 months. Sometimes we see women are changing the doctor just because they are not conceiving with ovulation induction. The previous doctor has given letrozole for 3 to 4 months. The next doctor has also given the letrozole for 3 to 4 months. This is waste of time. If that previous medicine is not working, then shift to the next treatment. You can try ovulation induction with gonadotropin injection. If that doesn't work, very few women will require IUI or IV. Thank you for watching this video. If you have any queries, please feel free to contact us through our Facebook page or YouTube channel. Thank you very much.